Hi there, I'm Dakoda, a certified prosthetist here at Spao Ottobock Care. Welcome to our channel. In this series, we'll dive into the entire prosthetic journey, covering everything from common causes of amputation to prosthetic components to residual limb health and returning to everyday life. In this series, we will cover the pathway to the lower limb prosthesis and hopefully answer any questions you might have. If you'd like to skip ahead, there is a playlist within this channel, so feel free to do so. The following videos will be directed at both the individual undergoing or have undergone amputation, their families, as well as health professionals developing their knowledge. If you have any questions, drop them in the comment section. We'll do our best to reply to them. On the other hand, book into one of our 5 clinical sites and get a face-to-face answer with one of our friendly clinicians. Before getting into the content, you might hear me say variations of the word prosthetic and maybe some other words unfamiliar to you. Let's run through some of those now. Prosthetic. The word used to describe a component. This may be used as a prosthetic device, prosthetic foot, or prosthetic user. Prosthesis. This word is typically used to describe a prosthetic device. It will be used in a sentence like, have you found the prosthesis to be comfortable? Prostheses. This is the plural word for multiple prosthetic devices. This is applicable to anyone with more than one prosthesis. We will also often use the word residuum, residual limb, or stump to describe the end of your limb. Why might someone be having an amputation? A person may be undergoing a surgery under elective or non-elective circumstances. In some instances, where an injury or a condition prevents an individual from being functional, that person may elect to have an amputation as a way of regaining their independence or functional ability. This may occur from traumatic accidents, psychological factors, or conditions such as proximal femoral focal deficiency, or other problematic birth defects. Other non-elective amputations may occur as an effort to save life or reduce the risk of life-threatening events. Traumatic amputations are often the result of a workplace incident, motor vehicle accident, however can occur due to a number of reasons. Amputations may also occur due to a number of medical reasons. Such reasons may be bone cancer, soft tissue cancers, infections from unhealing wounds, peripheral artery disease, and frostbite. The presence of diabetes is a large contributor to the amputee population due to its likelihood to decrease blood circulation. The condition can lead to poor blood flow, a lack of sensation through peripheral neuropathy, or damage to the nerves within the extremities. In some cases, when not monitored diligently, an undetected cut or wound can cause unhealing wounds or infection leading to an amputation. Who might need a prosthesis? As mentioned, anybody who has undergone an amputation or was born with a congenital deformity may utilise a prosthesis. Many different levels of amputation depict the kind of prosthesis that may be used. This diagram outlines the levels of amputation commonly seen. For amputations that go through a bone, the prefix trans is used. In the lower limb, this will be a transtibial and transfemoral. Otherwise, below knee and above knee may also be used. Where a bone is removed in its entirety, the level of amputation is depicted as knee disarticulation and hip disarticulation. Some levels of amputation have unique names, such as Symes, which is an ankle disarticulation, or partial foot amputations, such as Liz Frank or Chopart. What is the process post-surgery? Post-surgery, the individual with the amputation will require a stay in hospital during the rehab phase. In this post-operative phase, the rehab team will immediately work closely with an individual to minimise pain and ensure correct healing of the residuum. During this post-operative phase, it is likely a fluid drainage system will be used to help remove unwanted fluid buildups and reduce the risk of infection. Once the hospital team remove the drain, it is likely that a prosthetist will intervene with a removable rigid dressing, RRD. This dressing, often made of synthetic fiberglass tape, is easily removed, allowing frequent wound inspection. It simulates the donning and doffing of a prosthesis. This process assists in the shaping of the residual limb through controlling swelling and protection. Often being dubbed a crash helmet, these rigid dressings are especially beneficial in bed when an individual may roll over and knock their residual limb. Allied health professionals will often get the question, how long until I'll be ready for a prosthesis? The answer being, every person is unique. Therefore, every person's recovery time may also be different. Limbs for Life in Australia do suggest 1.5 to 3.5 months. Once healing of the residual limb has occurred and the rehab team have determined the individual to be ready for a prosthesis, they will then contact the prosthetist and organise an initial assessment or casting. In collaboration with the physiotherapist and the individual, the conversation surrounding short-term goals, long-term goals will occur. And this is the start of the prosthetic journey. The next video in this series will elaborate on different kinds of prostheses and how they may better suit an individual as they progress through the many stages in the prosthetic journey.